good afternoon, class. Sorry we missed a class which we are going to give you the lecture now on videos to your YouTube service. We are done with Primary Healthcare Unit 1. Now we are going into Unit 2, which is Community Structure and the Functions of Groups and the People in the Community. You know, community is all about people, and people are structured in the community and they function in groups. So also their health facilities has to recognize them the way they were. And for anybody that will go to any community to serve, must recognize the structure in the community before you can flow along with them, particularly health worker. You are not there to enforce your services, but to win them to gain access to service them. So community leadership, there's no structure without a head, and equally a tail. So community leadership structure is essentially about councillors as democratically elected representatives of their communities, working with local groups, organizations that enable them to make the best use of their combined skills, talents, expertise, and the imagination for the benefit of the local citizens. As usual, Nigerian people and organizations, communities were organized with representatives. At ward levels, we have councillors. So these are the people that coordinate the affairs of the community towards the government, as they are the people representing the government. So they work along with people to see how they service the community with the basic need of the community, which healthcare is one of the basic needs. So also, those councillors represent them. If anything requires the input of government, they organize themselves through the councillors as spokes to the government and make a requirement to the government, also contribute to the development of the community. And after the community patterns, we have families. As we know, community is made up of families, from units to extended families. So we have family patterns in primary health care. So all health workers in the community have to recognize these settings. Family patterns merely means the characteristics, quality of the relationship between the members of a particular family, e.g. between parents and their children. For example, when a parent is sick, or a child is sick, or any member of the family is sick, you have to consider the entire family were sick. That is the rules about family patterns. Family patterns vary widely in emotional tone and in the attitudes of the members towards each other. You have to recognize their affection, their affiliation, the connections they have among themselves when you are taking care of them. So you treat them holistically, meaning that they are not treating a person, they are treating a family. Staffing in the primary healthcare system. When we say staffing, it's all about equipping a facility with staffs, meaning those that will work. So healthcare staffing refers to process of hiring and managing medical professionals to provide patient care services in a variety of healthcare settings. Those professionals may include doctors, nurses, allied health professionals, and administrative staffs. Allied health professionals here implies other health service renders, We have pharmacists, we have lab scientists, we have social health workers, and so on. All of them contribute to health services provisions. So, as usual, we know we says human resources are the most difficult resources to manage. So also the challenges that may be faced in healthcare settings. It's not an assumption. There we have the workers in primary healthcare. This tells the workforce in primary healthcare are people that are engaged in the system and the service specific to primary health care. These include occupations engaged in the continuum of health promotion, disease prevention, treatment, rehabilitation, and the palliative care. So all those that render these services are the people that were involved as primary healthcare workforce. And those include the physician, the nurses, just as we mentioned there, the pharmacists, the lab scientists, also cleaners. They are also very important in healthcare system. The roles of nurses in primary healthcare. Nurses in primary healthcare have a key role in coordinating and monitoring patient care and have been shown to spend twice as long with their patients compared with the general practitioners. This is to tell users, yes, in the settings, in facilities, nurses get more time with their patients than all others, particularly the physicians or general practitioners, which are the GP. If you have a patient in the hospital admitted in a ward, a nurse is seated there throughout. If it is shifting, nurse is there. Both day, night, 24 hours, the patient is hanged with the nurse. The nurse is there to protect the patient. The nurse is there to coordinate all services to the patient, either from the physician. So if a doctor comes to see the patient, the nurse there is the patient advocate. You have to know who is that doctor, what is his specialty, what did he come to do, and you have to see what he did, and any order or law he gives on the patient you have to implement. You are the one that will do the implementation. So you see, you have to know, and you also have to be aware, is services right or wrong on the patient? Because you will not sit there by the patient, the doctor make a wrong prescription, and you didn't correct the prescription, or you didn't take notes to inform the doctor that the dosage is either too high or too low for the patient, or it may be contraindicating to other things. So it's a challenge upon the nurse to be knowledgeable, to have these skills and this knowledge along the sides. Also, lab scientists will come. For example, you have to be there to see how you support him to ensure that you achieve what you want to achieve in favor of your patients, so and so on. You are also to be there to counsel the patient to let him accept. Maybe they want to take a blood sample or so. So you have to inform the patient and guide the patient to achieve, to supply what they want. So